Good evening. My name is Lawrence Heyer. I am an orthodontist and have been in private practice for 20 years. I certainly appreciate the opportunity to discuss how the power of hygiene has influenced the way in which thousands of practitioners are changing their approach, but not just their approach, their entire staff's approach, and their outlook and how they handle hygiene and prevention with each and every patient. This webinar will be divided up into 3 sections. I will be presenting the first section, in which we will be discussing hygiene and prevention in general, and why it is important to all specialties of dentistry. We will cover why it is equally important for staff in orthodontic offices and pediatric dental offices to learn about the power of hygiene in this new age of dentistry, as it is for doctors and hygienists in general dental offices and periodontal offices alike. The second section of our webinar will address how oral health and systemic health are intimately involved. And this section will be presented by Professor Charles Hennekins, who I will be further introducing later in the webinar. We are so fortunate to have Professor Hennekins share his knowledge with us, as he is a world-renowned authority on the treatment and prevention of cardiovascular disease. And finally, the third section of our webinar this evening will address the question of how best to implement prevention into your practice and ensure that your entire team is on board, not just the doctor, not simply one assistant in a large team of a dozen staff members, and not just one hygienist in the office, but the entire team. By doing so, you will learn how to dramatically increase revenue in your practice. For this section, we are thrilled to have Ms. Christina Landino presenting. Christina is the head of sales of Plaque HD and has been in the field of dentistry for over 20 years. Dental plaque removal, as we all know, is one of the biggest challenges that our patients face today. Its improper and incomplete removal leads to many damaging effects we all see on a daily basis, such as demineralization, caries, gingivitis, and periodontal disease. The prevalence of tooth decay and periodontal disease is very high, despite the many stories we all hear from our patients who claim to be following our oral hygiene instructions we gave them at the very last appointment. In fact, according to the National Health and Nutrition Examination Survey from 1999 through 2004, the prevalence of caries in adults is 92%. I'm going to repeat that. Yes, the prevalence of caries in adults is a whopping 92%. Furthermore, and perhaps even more important, current research continues to point to the mouth as the gateway to the entire body. And poor oral hygiene has been linked to many illnesses, such as cardiovascular disease, stroke, preterm labor, and rheumatoid arthritis. As prevention becomes even more important in today's society due to the research involving this correlation between oral health and systemic health that I just talked about, the need for prevention is more evident than ever before. Demands on schedules and busy lives of adults, adolescents, and even children today tend to leave our patients with much less time to adequately clean their teeth and gums. Our busy lifestyles today make it much more challenging for our patients to keep their oral cavities healthy and plaque-free. Our patients tend to rush through their brushing routine because schedules today are complicated, and stress levels in society in general have become much more elevated than ever before. Furthermore, our diets have moved from foods such as pastas and breads, which are more basic, to foods high in proteins and juices, which are much more acidic. And this acidic environment leads to a much higher potential for decalcification and caries. The proper and complete removal of plaque is more important now than ever before. In addition to what I referred to prior to this, slide in order to avoid expensive and lengthy dental procedures that arise from inadequate oral care. And furthermore, changes in the oral flora, both of which are easy to avoid. It is our role as dental professionals to ensure our patients are educated and properly equipped to do so. Many of us have moved from recommending hygiene every 6 months to every 3 to 4 months. The benefits of more frequent hygiene visits are leaving our patients with healthier tissues and teeth. Educating our patients about plaque and the fact that plaque is clear is an absolute must for all of us. The name of the game today is prevent the problem before you need to fix it. As mentioned earlier, caries, gingivitis, and periodontal disease are among our biggest problems today. And due to the correlation between oral health and systemic health, and since we have preventive products which have been shown to be highly effective, it is a must for our dental teams in our offices to instruct our patients on proper brushing techniques, but not only that, to provide our patients with an efficient and effective tool to identify and remove plaque. A study by Nepali et al. In the Journal of Oral Research and Review in 2014 showed that use of a plaque disclosing agent improves the quality of daily oral hygiene performed at home. Now, we all know this. We learned this in dental school, and it's not a surprise to hear something like this. However, until recently, the standard products to help identify plaque have been disclosing solution or tablet, which are typically provided in the dental office and act mainly as instructional tools. In general, these are not viewed by our patients as being patient-friendly for daily use at home. In contrast, Plaque HD, plaque identifying anti-cavity toothpaste, is patient-friendly for daily home use. Plaque HD, being a plaque identifying toothpaste, aids in visualization, identification, and removal of plaque during the patient's daily brushing routine at home. This greatly improves oral hygiene for children and adults at home and reduces plaque on a consistent basis and not simply at that one instructional visit with the hygienist in the office. Plaque HD was developed by a dentist being mindful that patients visit us periodically and not daily. Yet we, as dental professionals, are asking our patients to keep up with their hygiene between visits. If we could provide our patients with a visual tool to ensure that they are carrying out our instructions, and if this aid was also patient-friendly for daily use at the same time, we can provide them with an invaluable aid. For example, don't we all ask our periodontal patients who have already proven to be inefficient in keeping a clean oral cavity to maintain good hygiene between recall visits? But in reality, they have no way of knowing whether they are doing an adequate job until they come back for their next visit. Our patients are too busy to take multiple steps and use multiple products at home. It's hard enough for us to get our patients to brush their teeth, never mind ask them to carry out additional steps. With Plaque HD, they are doing the exact same thing as they would do with their own conventional toothpaste, except with HD, it's teaching them how to brush by identifying the plaque that they missed by coloring or disclosing it a teal blue color. What you can see from this slide is where Plaque HD will typically show up in your average patient's mouth. And Christina will go into this in much more depth toward the end of the webinar. But what is important here is to educate your patients in terms of what to expect when using Plaque HD. While the teal color should not be visible over the entire tooth in your average patient, it will be seen in areas where there is some plaque left behind, which is typically along the gum line and interproximally, as can be seen here. Plaque HD's proprietary Targetol technology helps the patient by visually identifying the plaque by employing a plant-based coloring agent. The technology additionally helps in more efficient plaque removal because of its unique concentration and combination of cleaning agents. These cleaning agents work to weaken the core of the plaque structure immediately upon coming into contact with it. Now, that's not to say that in certain extreme circumstances, such as the orthodontic patient seen here who has excessive plaque accumulation, that the coloring will be far more evident. As you can see in this photo, the plant-based coloring agent is evident over the entire tooth surface simply because this patient, as you can see, has plaque caked on from not brushing adequately in days. With respect to orthodontic patients specifically, as we are all aware, rushing through oral home care can have deleterious results if the plaque that gathers around the brackets is not removed properly. This often leads to damaged enamel, decalcification, decay, and even periodontal disease in severe cases. Even with a successful orthodontic result in terms of alignment of teeth and bite correction, the lack of plaque removal can negatively affect the result of orthodontics. And you certainly appreciate that this can be terribly frustrating for the patient, and if the patient is a child, for the parent who's invested time and money into the orthodontic treatment. One of the most vexing problems orthodontists face on a daily basis is the constant need for oral hygiene instruction to both patients and their parents. So we can attempt to teach our patients how to keep their teeth clean at their recall visits every 6 to 8 to maybe 10 or 12 weeks, but we don't go home with them. Plaque HD takes all of that guesswork out by affording the patient the opportunity and the ability to identify where the plaque is accumulating in a one-step process. The disclosing characteristics of Plaque HD forces the user to remove the teal while brushing because, let's face it, nobody wants to brush their teeth but walk out of the house in the morning with green teeth. And as a result, it encourages the patient to focus on those specific areas and brush for a longer period of time. The concept of Plaque HD originated 7 years ago. After almost 5 years of extensive research and development, Plaque HD toothpaste with proprietary Targetol technology was perfected in order to combine these plaque-identifying disclosing agents and the chemistry behind them that I've discussed with the anti-cavity fluoridated technology of a superior toothpaste. It was extremely important to have the teal coloring agent be derived from a plant-based product and for it to be certified gluten-free. In fact, several scientific studies on Plaque HD have been conducted, and it has been proven to be more highly effective in removing plaque as compared to a conventional toothpaste. The first study published on Plaque HD was published in the peer-reviewed International Journal of Dentistry and Oral Science by Stevens et al. In 2016. 31 adult participants enrolled in the study, and they were randomized and divided into 2 groups. The control group participants brushed with a controlled toothpaste, the controlled conventional white toothpaste, for 2 visits, and these visits were spaced 7 to 10 days apart. The experimental group participants brushed with controlled toothpaste for the first visit, and then brushed with Plaque HD for the second visit. These visits were also spaced 7 to 10 days apart. Prior to all visits, participants discontinued oral hygiene for 12 to 16 hours. After brushing, participants rinsed with fluorescein solution and intraoral photographs were taken using a UV digital camera. The presence of plaque on tooth surfaces was visualized by plaque-bound fluorescein and then quantified. Images were then, from both visits, compared using custom software to calculate percentage change of remaining plaque. So, what was found after comparing these 2 groups? Well, what was found was that the participants using Plaque HD toothpaste demonstrated a highly statistically significant plaque reduction between visits. Specifically, a 51.3% reduction with a p-value of 0.015, and as we all know, that is highly statistically significant, as compared to the control group, who showed an 8.3% reduction with a p-value of 0.189, which of course is not statistically significant. The conclusion of this study was that mechanical plaque removal by brushing with Plaque HD toothpaste containing plaque-identifying targetol technology reduces more plaque in the mouth to a highly statistically significant level as compared to the conventional white, non-disclosing control toothpaste. Current research correlates oral health to overall systemic health. It has been stated that the oral cavity is the window to the health of the entire body. It is absolutely crucial that we, as dental professionals, educate our patients on the importance of keeping a plaque-free environment. Our patients come to us seeking expert advice, and they deserve to know that practicing proper oral hygiene is not just a matter of, well, getting a cavity or not. It's a matter of that it can dramatically impact the health of the entire body. In fact, in a recent review, it revealed that there were almost 500 articles, 468 articles to be exact, that have been published since 1991 involving the relationship between poor oral hygiene and the presence of atherosclerosis, which is often a form of ischemic heart disease. It is time that we as dental professionals take responsibility and not only create beautiful smiles, but also impart this knowledge to each and every patient who walks through the front door of our offices. At this point, I would like to introduce our next speaker, Professor Charles Hennekens. Professor Hennekens occupies the only endowed chair at the Charles E. Schmidt College of Medicine and Florida Atlantic University. He became the first John Snow Professor, as well as the first Eugene Brownwall Professor of Medicine at the Harvard Medical School, and first Chief of Preventive Medicine at the Brigham and Women's Hospital. He discovered numerous therapeutic lifestyle changes and adjunctive drug therapies to prevent and treat heart attacks and strokes. For example, his New England Journal of Medicine publication in 1997 on aspirin, inflammation, and heart attacks was recently named the most influential last 20 years. From 1995 to 2005, he was the third most widely cited medical researcher in the world, and 5 of the top 20 were former fellows or trainees of his. In 2012, he was ranked 81st in the history of the world for saving over 1.1 million lives. In 2015, Professor Hennekens was ranked as the 14th top scientist in the world with an H-index of 173. So without further ado, I will hand it over to Professor Hennekens.
Thank you, Dr. Heyer. A large body of evidence supports the hypothesis about oral systemic health. Nonetheless, randomized data are sparse about whether a plaque-identifying toothpaste reduces dental plaque, and non-existent for whether a plaque-identifying toothpaste reduces inflammation. Inflammation is intimately involved in the pathogenesis of atherosclerosis and is accurately measured by high-sensitivity C-reactive protein, or HSCRP, an accurate marker of inflammation and a sensitive marker for cardiovascular disease. Based on this background, in collaboration with Professor Carla Evans at the University of Illinois at Chicago School of Dentistry, as well as Professors Pat McBride and David Demetz at the University of Wisconsin School of Medicine and Public Health, we embarked on a randomized trial to test whether this plaque-identifying toothpaste would reduce dental plaque as well as inflammation. To do so, we did statistical power calculations and randomized 61 apparently healthy subjects aged 19 to 44 years We assign them at random to either the plaque-identifying toothpaste or an identical placebo toothpaste for 60 days. We actually ask them all to follow a strict protocol for brushing, and we assess changes from baseline to follow-up in both dental plaque and high sensitivity C-reactive protein. In an intention to treat analysis, the plaque identifying toothpaste reduced the mean plaque score by 49% compared to a 24% reduction in the placebo group, and the p-value on this comparison was 0.001. In a pre-specified subgroup analysis of the 38 subjects with baseline levels greater than 0.5 milligrams per liter, the plaque-identifying toothpaste reduced HSCRP by 29% compared to a 25% increase in the placebo toothpaste group, and the p-value on this comparison was 0.041. Now, these findings were published in the American Journal of Medicine online ahead of print on October 19, 2016, with an accompanying editorial by the editor-in-chief, Joseph S. Alpert, a renowned cardiologist, who asked the question, can this toothpaste reduce risk of cardiovascular disease? Of historical interest, when he was a boy growing up in New Haven, his father, a dentist, took him into his office and had him look in the mouths of some of his patients and said, Joseph, you will find in the future that the condition of the mouth of these patients will influence their overall health, especially cardiovascular disease. So the hypothesis has been around for a while, but this small trial did show that the plaque-identifying toothpaste produced statistically significant reductions in dental plaque and HSCRP. The observed reduction in dental plaque confirms and extends the previous observation, as Dr. Heyer explained, and this observed reduction in inflammation supports the hypothesis of a possible reduction in risks of cardiovascular disease. Of course, the direct test of this hypothesis will require a large-scale randomized trial of sufficient size and duration. Such a finding would have such major clinical and public health implications that I am now working with my colleagues at the University of Wisconsin, where Professor Demetz had founded the Wisconsin Research Network, and Professor McBride is now in charge of it to really propose an NIH grant proposal to test this hypothesis to get a sufficient number of clinical events to distinguish between the null hypothesis of no benefit and the alternative hypothesis of a small to moderate reduction. So in closing, I would say that although excuse me, I'm sorry for that interruption. I wanted to point out, as someone who's devoted his career to the treatment and prevention of cardiovascular disease, there is no question that the first-line way to prevent and treat cardiovascular disease is through therapeutic lifestyle changes, such as avoidance or cessation of smoking, avoidance and treatment of obesity, and being more physically active. In fact, we are one of the fattest countries in the world. For the last 15 years, we were #1 in the world. Now we've become #2 to Mexico, but #2 is not a good place to be in. In fact, it had been predicted a long time ago by people like myself that the decline in mortality would probably not continue, and indeed, from the most recent NCHS data, that is the case, despite the fact that for the last 10 years, most of the improvements have been through what I call better living through chemistry, the adjunct of therapies of statins, aspirin, ACE inhibitors, angiotensin receptor blockers, and beta blockers. the point of this discussion is to point out that if a simple intervention such as plaque HD would in fact be able to show reductions in heart attacks and strokes, then this would have an enormous public health appeal because of its lack of side effects. And we are currently attempting to try to test this important and timely hypothesis. And thank you very much for your attention.
And thank you so much, Professor Hendekens. At this point, I'm going to turn it over to Christina Landino. Again, Christina is the head of sales of Plaque HD, and I will turn it over to her right now.
Hello, my name is Christina Landino. Briefly, my background is that I did sell brackets for 5 years or so, sold dental implants, and also worked for Invisalign for 15 years. I was an original rep, so I do have a good ortho dental background. There were some points made about Plaque HD in Dr. Heyer and Dr. Hendekens' presentations that are really important for you to focus on. Mainly that Plaque HD does contain fluoride. It's a standard 0.24 sodium fluoride. So in other words, the entire family can use the toothpaste, not just the patient in brackets, but we also have a very big pediatric market. It's a good tool for youngsters learning how to brush their teeth. It's a good tool for parents and that are very particular about how their teeth look. So it can be one toothpaste for the entire family. The toothpaste comes in 2 flavors, fresh mint and berry bubblegum. There's 12 tubes to 1 case, 1 flavor per case. It's important to know that the colorant in the toothpaste is made from a plant, so it's natural. There's no red dye in the toothpaste. The toothpaste is also gluten-free, so there's no more worrying about, if you remember, disclosing agents, and that's a second step there. There's no more crunching on a red tablet and getting your face stained and your sink stained and your clothing stained. That's all over. Plus, that was the second step. You can barely get people to floss, let alone start crunching on tablets. So the beauty of Plaque HD is it's a fluoride toothpaste that as you're brushing, you brush thoroughly, just like normal, and then spit out, and you do not rinse at that point. You look in the mirror and you see where there's green spots where you missed your brushing. At that point, you take your toothbrush and you put it back in your mouth and you continue to brush until you brush away where all the green spots remain and spit out. And then when you see that there's no green, then you rinse. That's the proper way to use the toothpaste. We have several very, very nice tools that you'll see as you get into using Plaque HD. This picture here is very powerful with the before, we call this the before and after. So you have your before teeth that are dirty, your teeth while they were brushed with all the green hue, and then your clean teeth on the other side. And then we also have them without brackets. So we provide these cards to you so you can use them to show your patients. You can put them in your starter kits. You can put one on every table in your operatory. You can put them in your office. On the back side of that card is step-by-step instructions, which it's really important to teach your patients how to use the toothpaste. So the nice thing about it is you only use a pea-size amount of the toothpaste. So if anyone thinks that it's pricey, and we'll get into that in a minute, it lasts longer than a tube of toothpaste because you only use a pea-size amount. So the benefits of Plaque HD are it's a one-step plaque identifying toothpaste with fluoride. So it's a very good benefit for your patients. Now, we also offer a doctor locator. So my slide says you want to be on the cutting edge. If anyone's looking to buy this toothpaste, they can only get it in a doctor's office. We have a web locator where they can punch a zip code into the web locator and see what doctors are carrying Plaque HD in their office. Now, some of the sales tools that we offer you, I mentioned this 3x5 card. So it has the pictures on one side and the step-by-step instructions on the other. We have table tents that are with braces and without braces. And a nice tool that some doctors do, they'll take a box of toothpaste and they'll put it in their checkout area. The average doctor charges their patients between $20 and $25 a tube in their office. So they might write $20 on the box, put it in their checkout area, and put a table tent right next to the box. So as the mom's checking out, she sees the box, she sees the $20, she sees the table tent. She might ask the front desk, "What is this?" And the front desk simply says, "This is a toothpaste that we sell here that will allow you to monitor your child's brushing at home." As you know, moms would be all over that because they all come into the office and say, "My kid's not brushing." You hear this 15 or 80 times a day, however many patients you see. It's the biggest problem in the office. It's solved that easily. And if you keep it behind the front desk, the moms are, "I need that." The front desk just hands it over, adds the $20 onto their bill, and it's done. It'll be the easiest thing you've ever sold in your life. We also have a beautiful bonding day video that you can use during a consult. Put it on your Facebook page. It says, "Congratulations, you got your braces today. Now it's important for you to take care of them. Introducing Plaque HD," and then it shows you exactly how to use it step by step. We have a pediatric video. We have just a step-by-step video. We also have Dr. Hennigan's entire study on our website that you can print out and give to your patients that are interested in studies, because there's a lot of very particular parents that want to read everything, and we can also provide that for you. We do not have samples. It's probably going to be the first question anyone asks. We've been extremely successful without samples because you simply tell the doctor, "Doctor, the minimum order is 1 case of toothpaste. We're talking about $120. You'll be done with your 1 case in 1 day." Typically for me, if I'm at a trade show, when someone buys 1 case, within 2 weeks they're calling back and they're ordering 10 cases, or 20, or 30, or 40 at a time. I'm not making this up. The doctors tell me they can't keep it on the shelf. There's 2 things you can do in your office. You can give away your first tube. Maybe some offices, you want to ask them, "Are you giving away a Sonicare?" You know, instead of giving away an $80 toothbrush, why don't you give away a $10 box of toothpaste that's really going to help them? Because a toothbrush is a toothbrush. Just because you're using a Sonicare doesn't mean you're removing all your plaque. So, but if you give them Plaque HD, they're going to be assured that they're brushing thoroughly. So you can give your first box free in your starter kit, and then when they come back and they want another tube, you can charge them the $20. Or if you're not comfortable with giving it away at all, then sell it right from the beginning. I have offices that do both, so that's your choice. But you do want to have a table tent at the checkout, in your waiting room. We have beautiful 8x10 glossy cards with the before and afters. Again, the 3 sets of teeth, the dirty teeth, the teeth with the green hue, and the clean teeth. This is something that you really want to have all over your office, and we're happy to provide that for you. The biggest thing is, can you sell 10 tubes a day? How many patients do you see a day, doctor? 40, 80? If you mention this to every single patient and every single mother, you're going to have a sale every single time you mention it. You can keep a tube in your brushing area if you want. If you're worried about cross-contamination, you can dispense a little bit on a Q-tip on a brush. If the doctor has pre-pasted brushes, it's okay to rinse that off and put Plaque HD on there. That'll work just fine. You sell 10 a day, 5 days a week, for 50 weeks. That's $52,000 extra a year by selling 10 units a day. And trust me, you can sell 20 units a day. I have people who sell case after case after case a day. So it's truly a very, very easy sale and a very, very good benefit for your patient. So thank you very much for your time. I'm going to pass this back over to Dr. Heyer to wrap this up, but my name and email will be posted. I'll be happy to answer any questions. If you want to run any ideas by me, that's what I'm here for. I'm here to help you be successful. So thank you very much for your time.
Thank you very much, Christina. We do have a few minutes for some questions that we've received. We have received numerous questions over the last 40 to 45 minutes. So what we'll do is we'll go right to the Q&A period, and I will start off by answering a few questions here. So the first question we have is, in our dental office, should we recommend to our patients to use Plaque HD every time the patient brushes? And the simple answer to that is it's absolutely recommended to use Plaque HD a minimum of 2 times daily. Plaque HD, as I mentioned before, is, and as Christina mentioned, is a fluoridated toothpaste. And it really replaces whatever toothpaste the patient has been using previously. So absolutely, Plaque HD should be used twice a day, and there's no need for any additional toothpaste. We have another question for Professor Hennekens, and he'll take over for now.
Well, one question I see here is, could you tell me a little bit more about the levels of high sensitivity C-reactive protein predicting heart disease risk? Well, first of all, high sensitivity C-reactive protein is a sensitive but non-specific marker. Levels below 1.0 are low, 1 to 2 are average, and greater than 3 are high. However, it's also been shown that if they're 10 or above, then there is another cause of inflammation systemically that's overwhelming the ability to predict the heart disease risk, such as an acute infection or perhaps even a chronic autoimmune disease. So CRP is a very sensitive but not specific marker for future disease. Now, another question I have is, does the fact that CRP is reduced mean that heart attack risk will reduce? Sometimes yes, sometimes no. The only way we can know is by doing the study, and that's what we're embarking on now.
So the question was, can Plaque HD be used like any other toothpaste? Can it be used with electric toothbrushes? And the answer is absolutely. Plaque HD can be used with electric toothbrushes, with a manual toothbrush. It's used in exactly the same manner as a conventional toothpaste, and that's really the beauty of it. I see another question coming through that's asking, does Plaque HD stain teeth? The answer is absolutely not. Plaque HD does not stain teeth. The purpose of it is to disclose or color teeth, and simply identify where the plaque is, and then it's simply brushed off and does not stain teeth. So I believe we've come to the end of our Q&A session and our webinar as well. Thank you very much once again for your time and your interest in this evening, and good evening to all.